region. A little bit about today's agenda. We're going to talk about the National Career Readiness Certification. There was a meeting held in August on the 27th. For those of you who might not have been able to attend, we'll have information about that. The Developmental Disabilities community met a few weeks ago and talked a little bit about what their workforce issues are. So we'll recap that discussion and talk about next steps. Then we'll have an update from the College of Southern Maryland and the Workforce Development Board of Tri-County Council for Southern Maryland. And then we'd like to spend the bulk of our time on open dialogue. So Ellen, would you like to start?
Yes, good morning, everyone. It's great to see all of you again. Just want to talk a little bit about the meeting that we held on August the 27th. I'm not sure how many of you had the opportunity to join me, but in our last convening at a town hall, we asked you a specific question, and it was whether there was interest in a national certification that could measure a person's ability to think critically, to analyze technical documents, and to understand math and basic math theory. And overwhelmingly, there was an interest in finding out more about that type of certification. So on the 27th, it was our briefing to the community. Your group, amongst many other leaders, were invited to hear about the ACT National Career Readiness Certification. And without taking a whole lot of time this morning to recap that, particularly for those of you who participated, what I will state is that there was much excitement from the participants in that meeting, and our efforts as a region, excuse me, and as a workforce development system is to move our community forward in a process so that we can obtain a designation as a work-ready community. In order to receive that national designation, you need the support of your local workforce development agencies, your county governments through their economic development departments, your chambers of commerce, your K through 12 systems, and a representative number of industry. We've made the decision that we will pursue this designation as a region versus as independent counties, and that we're going to engage as many industry partners as possible around the conversation of becoming a work-ready community. In short, what a work-ready community means is that the employers in that community recognize the importance of the National Career Readiness Certification and that they recognize it in their hiring practices. It does not mean that you exclude hiring people who do not have that certification. What it means is when someone walks through the door with that bronze, silver, or gold badging level of certification, employers know what it is. They recognize it. They understand the skills that that person has because they have that credential. So we've just started our regional campaign on educating businesses about this credential. Our economic development and Chamber of Commerce partners are pushing this information out to the community. You may have received something from one of the chambers or economic development offices already asking you as business leaders to sign up and say, yes, we want Southern Maryland to be a work-ready community. There is a ton of information and statistics that point to an increase in employability, employer satisfaction, and employee retention in communities around the nation that have work-ready designations. So we're moving in that direction to further help strengthen our pipeline. And so I'll be happy to share with anyone who missed that conversation on the 27th, the website information and the details, or to take some time on an individual phone call and answer any additional questions. But wanted to make sure you were aware of it, and hopefully you'll be a part of it as we move forward to support all industry in the Southern Maryland region.
Okay, thank you, Ellen. Does anyone have any questions about the National Career Readiness Certification or the steps moving forward? Okay, let's move on. When we had our industry roundtable in July, we heard very clearly from the developmental disabilities community that they have a workforce crisis. So we agreed to meet again with that community. We did so on August the 20th. We had robust attendance in that meeting, and we heard very clearly that a big part of the problem with this recruiting and retention problem that this disabilities community has is that they're simply not paid enough. It was stated that direct care seems to be not valued enough to allow higher wages. And they see their workforce shuffling from agency to agency for a few pennies difference in pay. The employees in this community are working often alone in a home, in charge of the lives of the people that they're looking after. It is such a responsibility, and the pay just simply is not commensurate with the amount of responsibility. In order to stay in one of these jobs, what they've found is that it has to be someone that really has the passion for the work, or else they're going to go to Target and make $15 an hour easily. So we talked about some, let's see here, anything else? One of the things we talked about that we'll be looking at going forward was the fact that there is growth potential in this industry. They tend to train and promote from within. And so we're looking at career pathways, better ways to explain to potential employees what the career pathways are in this industry and the fact that there is room for growth and potential for moving up. Let me see one more thing. Okay, we talked about next steps. Excuse me while I shuffle through my COVID notes. Within the next week, Ellen and I are working on a survey to go out to the developmental disabilities community to learn more about what their pain points are and what their jobs look like, what the roles are for employees in this industry. And we will evaluate the results of that survey and reconvene and talk about some models of collaboration that exist that have been used in other industries that we may be able to apply within the developmental disabilities industry. Ellen, would you like to add anything to that?
No, I think you did an excellent job explaining it. I think the other piece of good news that is something we're going to be exploring with that community is that there's some funding opportunities that can help support some strategic planning and consulting support that we'll be exploring with that group. We've identified a source that we think can really help. We realize the salary disparities are a big issue. So we've already started discussing how we might help begin to address that by offsetting some training costs. But I think the consulting services that could help leverage some really long-term strategic support. So we're excited to be able to bring all of that back to the group when we reconvene.
Okay, thank you. Any questions before we proceed? Yeah.
Ruthie, this is Kelly Winter. So I've been doing some exploration of what the direct service personnel's training program looks like. You know, it's kind of pending coming out from the state because I had some free time.
Yeah, you did.
And I've been kind of looking at how they train those entry-level folks and how that would align with or create a stairway up into some other career tracks that would be a good opportunity for these folks if they started here we could help them progress up along this career path. And I've come up with 3 paths so far, and I'll leave it at that. I should be ready to share it probably in a week or so when I get some final information. I've requested some additional information from DHHS on their training program and their entry requirements. So I've just been exploring it to give so that we could present back to that group what the opportunity could look like to create a career path for them.
Wonderful. Okay, Kelly, do you want to give a little update regarding CSM training?
Absolutely. Let's see. Is it possible to share my screen? Because I'm going to throw numbers around a little bit on courses and things like that, and it might be a little difficult for folks to see.
I think you can, Kelly. Give it a shot.
Okay, there we go. How's that? Can everyone see? I have a document up called Certified Medical Administrative Assistant.
Can you make it bigger
I can.
for the blind? Yeah.
I don't know if I can. Oh, here we go. How's that?
Oh, that's much better.
Okay, so this is a pathway that I'm looking at building from the workforce to the academic side. And it's more along the lines of administrative medical office support, starting with a general front office person, which would be, we currently have that in place. It's a medical administrative assistant. And then adding some billing and coding, which I see quite a few ads in the local, on the local job boards for looking for billing and coding specialists. And finishing it out with some electronic health record training. Now, the first 2 sections of this would allow an individual, after completing the workforce side, to move over into the academic area, into their medical coding specialist academic certificate. So we would work through that alignment just like we work through the alignment with our clinical medical assistants. And the completion of all 3 of these programs would allow them potentially to step over into the health management AAS degree. Each one of these areas has its own individual National Health Careers Association certification that comes with it. So an individual could jump off of this pathway with a credential in their hand at any one of these 3 steps, which I thought was a nice opportunity. So that's, and you see I have some timelines on here. So that's kind of what we're looking at along that pathway. On the workforce side, we've attempted to launch some administrative and billing and coding pieces in the past, which haven't been heavily enrolled, but I think we lacked direction and a pathway that was clearly communicated to individuals with interest in this area. So the next thing I would like to share is about our medical assisting program, which is currently in place, and our pathway that we created. And I'm going to scroll to it. Is that big enough?
We're seeing the same screen.
It should be. You should have it.
The Certified Medical Administrative Assistant is what's on the screen.
Okay, let me see if I can get the other screen back.
You may have to stop sharing and reshare. I don't know why that happens, but.
Okay, stop sharing.
Mm-hmm.
All right, let's see. Okay. How about now? Clinical medical assistant.
There it is.
Okay, so this pathway is up and running and complete. We have 15 registered students in the cohort that started yesterday. I've asked the instructor in this group to survey her students this go round and see how many of them will be interested in proceeding on this pathway. But this takes our workforce clinical, certified clinical medical assistant into the registered medical assistant program over on the academic side, where the workforce student will earn a total of 6 academic credits upon completion of our program. Certified clinical medical assistants are the entry level practitioner in this realm. The gold standard for the industry is the RMA, or the registered medical assistant. So having a student come in on our side, the workforce side of the house, and earn this certificate rather rapidly could get them out in the field working and keep them moving along an academic pathway to a gold standard level, more professional, more advanced level of medical assisting that of course would earn them a greater income. So those are the 2 pathways that I'll share. And then we have been working with a vendor to provide some, Ellen, what would you call it? Some online?
Yes, online on demand, really online on demand modules. They're wonderful trainings.
So these modules are about, it may take an individual anywhere from 45 minutes to maybe an hour, I would say, to complete these modules. And I'm going to share my screen because the list is very, very long.
Mm-hmm. Yes, it is.
And we deployed some of these modules most recently when we were training our community health outreach workers for the Charles County Health Department. So if you look in the first category here, can everyone see that? I'll see if I can make it big enough so you can see the titles but not have to shift your screens. How about now?
Yeah, we can see the titles.
Okay, so some of these titles, these are some of the proficiency titles. These, what you see highlighted is actually some of what we were using for our community health outreach workers. And if we go back, I think I can get this one big enough so everyone can see it. Titles viewable?
Yes.
Okay. So these are some of the specific healthcare titles, and it is a self-paced asynchronous learning, and individuals work their way through these, and they are able to produce a certificate with an assessment of learning at the end. And some of them are very relevant for what's going on today around us in this pandemic. The OSHA proficiency is one, population health proficiency, infection control. And then if you come down here, you can see that there's also PPE for infectious disease prevention and contact tracing basics. So these are some of the healthcare titles that may be of interest to individuals that are already in the healthcare career field that want to take a step up, earn some additional skills, a certificate of completion, and perhaps be better aware of the pandemic surroundings or just topics that were relevant in today's healthcare training. So these would be good for medical assistants. We have our medical assistants taking 2 of these. Some of our CNAs will be using some of these. Some of our nurse refresher students will be using them as well. So that was kind of, I can provide a list if anyone's interested, but that was kind of a brief overview. Ellen, did I miss anything?
No, I just wanted to state that, right now, many of those trainings aren't listed on the CSM website or catalog, but they will be in the future. But if you see something of interest or you're interested in getting that list, Kelly can share it with you and we can offer them on demand, even though they're not in the catalog yet. But they're very, very good trainings. And we know it's important for all industry in this environment to have training that's accessible from the workplace. And so collaborating with vendors to bring training that's affordable and accessible is really what we've been focusing on based upon what we heard from all of you over the last month or two.
Okay, very good. Any questions for Ellen or Kelly? All right, let's move on then and talk about the workforce development system in Southern Maryland. The Workforce Development Board under the Tri-County Council for Southern Maryland has programs, has processes, has offerings that can help you in your recruiting efforts. And those are posting your jobs in the Maryland Workforce Exchange, which is the state database of jobs that are open. The Maryland Workforce Exchange does more than that. It filters in job openings from other websites, from job boards, from classified ads. So it's a very important tool for job seekers, but it's also an important tool for the businesses that are seeking talent. And what we do on a regular basis and what we have been doing remotely now for 6 months and doing it very well is something we call customized recruitments. So when a business has a hiring need for one or more positions, we throw together a virtual customized recruitment. And Belinda, can I tap on you or Yvette to talk a little bit about what that looks like in the virtual world, what business feedback you've been getting regarding these customized recruitments?
Yvette, why don't you talk about it since you've been the one that has been hosting these?
And right after Yvette, we do have a question for Kelly that just popped up.
Okay, great. Good morning, everyone. Yes, the the virtual customized recruitments have really been doing really well for the businesses that we have been hosting them for. They have found them to be very efficient and been able to find a lot of great talent for them this way. And actually what we're doing is we're using the Microsoft Teams platform to actually take care of the customized recruitment just as if we were in person, where we are doing the pre-screening of the candidates. We market the openings, we do the pre-screening of the candidates, and then we line up the interviews for the business. And so they find that when they're able to come on to the virtual recruitment, it's very efficient. The talent has already been pre-screened so that they're finding candidates that are ones that they, really meet the qualifications. And then also that the candidates are actually, showing up, they're relaxed in the fact that, they're in their own environment, and therefore the business is able to get a better gauge of whether or not that candidate would be a great fit for their culture, for their company, and for the experience they need. So I've had a great success with the customized recruitments. Our team has been working with that, and the businesses have had very, very positive feedback.
Great. And Yvette, while you're at it, why don't you tell us a little bit about September 23rd?
Absolutely. So on September 23rd, we have our virtual hiring event. We've taken the 9th annual Southern Maryland hiring event, and now it is virtually. And so we still do have booths available for the businesses to register. It's a $125 registration fee, but I'm telling you, we have mass marketing that actually starts today. We have tapped into television, radio, social media, every advertising platform there is to really get the word out. We are focused on our job seekers here in the Tri-County area, but because it's virtual, it's actually going to reach out within, our bordering counties and throughout the DMV area. So we're anticipating a large turnout for this virtual setting. And I can tell you now, even though we have not the advertising has not officially kicked off until today, we already had, just through word of mouth in the social media that we were posting, we've had 150 job seekers sign up. So we're expecting, by the time the advertising kicks in, starting today on through the 23rd, we have a goal of at least 1,500 job seekers. Virginia did use the same platform, and with their advertising campaign, they had over 6,000 job seekers on there. So we are really looking for a huge turnout. This is an easy way for the job seekers to actually be able to, right in their home, interview and talk with businesses about prospective opportunities. You're right there in your, your office or home, and you're able to easily engage with these job seekers. And you have a chat feature. You're able to brand your business using video, using your logos, using your company profile, listing all of your openings that you have available. And so it's just going to be a great opportunity to really get the information out about the opportunities you have for your business. And you even have the option, if you would like to do a video interview, a virtual interview with the job seekers, you can do that as well. So you have the chat and you will have the video feature as well. So it's going to be a really great event, a great opportunity for the businesses and the job seekers both to, find and get the opportunities that they need.
Wonderful. So there is opportunity for one-to-one, a business person talking to a job seeker.
Yes, yes. So even in the chats are one-on-one chats, and you can chat with more than one job seeker at a time. And then you can individually decide whether or not you would like to use a video platform as well, and then have a one-on-one virtual interview with someone if you found some talent that you really wanted to speak to right then and there. And the job seekers are, the way that we're advertising it is to let them know to expect that, so that in that way that they're already ready, if that is an option you would like to use, to be prepared to have a virtual interview that same day.
And what time?
And Ruthie, I might add that the interface is so user-friendly. It absolutely looks like you were just walking right up to a booth, and you can click on different icons they have there, whether it's the the job descriptions or the company profile or whatever. So it's very user-friendly, not difficult at all. I really think it's gonna work well.
Wonderful. And what time is this event on the 23rd?
It's from 10 a.m. to 4 p.m. So it gives you that broad range of time that, job seekers can come in at their lunch hour if they're working already in the field, and it's talent that you could to tap into, but it's in the morning and the afternoon. So we tried to cover all bases, and it's really going to be a great opportunity, for the businesses to find some talent.
Yeah, we at the Tri-County Council, we are very excited about being able to host at all the 9th annual regional hiring event. And with the experience we've had from virtual customized recruitments, and with the ease of access in this platform, we really think it's going to be a huge success. And if the world is open for business for the 10th annual, we may just go virtual regardless. One last thing I wanted to offer, with our federal funding that comes from the U.S. Department of Labor for workforce services in Southern Maryland, we can also do group trainings for eligible individuals. And by eligible individuals, it's typically those who are unemployed, underemployed, or have lost their job through no fault of their own. So if a business has a need for, let's say, 8 CNAs, we can do a training for you and produce 8 certified CNAs at the end for you to hire. So I just wanted to throw that out there as another opportunity. Ellen, would you like to add to that?
No, I just, I think it's good for, one of the things that we hope to communicate in these town halls is that we're here for you. Our programs and our services exist to support you. And the only way we can do that effectively is to have conversations with you about what your needs are. as early as possible. Those projected needs are so important because it does take a while to put together curriculum, find the right instructors. It's fine if we have existing coursework, but if we have to develop new coursework, we need that time. But we'll work with you to find the funding, to find the resources, to find the right partners, to bring these workforce solutions to bear. That's truly what we're here for. And I don't know if you've ever had the feeling that this system sort of existed in isolation from you. You didn't quite know how to tap into it, but we're hoping that these convenings quarterly will give that, will bring us closer together. So with that, we're going to try to take some time during each of these to give you some updates, like we just did. But more importantly, we want this to be a time for you to communicate with us and talk with us. And it's your open forum. You'll tell us the things that you want to talk about or the things you want us to know. So we thought that we might start at least this first one off with a question to pose to you as a group of healthcare providers, to get the dialogue going. But if there's something else we'd rather talk about during this last 30 minutes, we want to do that. So we want to just continue to say this is your forum. So the question that we've come up with that we thought would be insightful for us as well as for you to hear from each other is, now that the schools are open, how has this impacted your labor force availability? Or has it? And so if you want to respond, just raise your hand. Rochelle will call on you and we'll go from there. I think there's a hand up. Clarissa?
Yes, how are you? Good morning.
Good morning.
Good morning. First of all, I would like to thank everyone for continuing to pull these virtual sessions together. It's good to have an understanding of what's happening as far as the workforce development. And I'm completely honored and pleased that you're taking special attention to the disability crises as far as our staffing. So I do appreciate these meetings. In regards to childcare issues, we have thus far only one person that had to actually leave the organization because of childcare. We did a lot of things to try and reissue a different schedule, a different shift, but unfortunately it just did not work out. Some of the people that are currently still being paid, it's only about 3 people that we are currently paying, and we have been paying since April. Who have child care issues. We're doing so through our PPP dollars, but that's going to expire soon. So I'm not sure how many other people will be affected. But right now, just that one.
Carissa, just a quick question. Do you anticipate that once those PPE dollars run out, is the conversation with those individuals that they'll return, or do you think that might result in losses as well?
It will likely result in losses because if they had any options to work now, they would. They just cannot. Many of them are from a single family home and they don't have that natural support system available. So if the schools are closed and then on top of that, their daycare that they were using is also closed, that would likely lead to an unemployment situation for that employee. And of course, another vacancy for us.
Yeah. Well, I think that's certainly where Yvette and her team can help you.
Elizabeth has a question.
Hi, I just wanted to add, MELA doesn't have any residential facilities, so we've been able to do a lot of things virtually. And in moving and shifting, I found it as a supervisor very interesting. So I needed to pivot and move things to a telework environment for some of my employees because they're my best employees and I didn't want to lose them. The participants loved them. So we just needed to work things out and come up with an agreement where majority of their time is telework, but they do have to report during mandatory meetings and trainings and such. So that's been extremely successful. There's been some challenges finding enough phones and laptops, et cetera, but we've been able to work out that situation. And I think in some ways we're a better organization because we've had to think on our feet and do things a little bit differently.
Great points. Anyone else? That issue or other emerging issues since we last spoke, or solutions that you come up with, if there were previous issues that you've now resolved. It's your time to learn from each other. So Elizabeth, while people are thinking, a question for you. In terms of telework practices, was your organization able to identify and pull together policies that now reside in your HR department, or is that an area where support could be used, some type of information session on telework policies?
Yeah, so the policies have had to bend. I say that we're still working with our board of directors in approving new policies. What I was able to work out with HR is an individual agreement with my department. I had to outline what the expectations are the non-negotiables, if you will, what the employee would be responsible for, et cetera, and what would happen if that did not occur. And I've had absolutely no issues or problems whatsoever. I'm kind of surprised. I want to knock on a piece of wood right now. But it was very difficult because normally our telework policy was very limited. Mm-hmm. And we had to find out, we had to rewrite curriculum. We had to rewrite how we were going to deliver services. It was very fluid. For a while now, it seems pretty firm because it looks like the situation's not going to improve in some time. So it's just going to get better and better and better. Mm. So yes, policies, procedures, everything had to be gone through with a fine-tooth comb with our QA department. And I had to get approval from everyone all the way up to the CEO to be able to do things a little bit differently. But I don't feel I had any choice. Mm-hmm. It's either you lay off these great employees because they can't perform the task in the way that you want them to, or you figure out a way to move forward.
Love it.
We have two questions, Bonnie and then Clarissa.
Hi, thanks. This is Bonnie Grady from Charles County Chamber of Commerce. And I wanted to speak specifically to any long-term care providers that are on the call, but really any groups such as a developmentally disabled community as well. Any of the groups that are on here that would want to create a smaller subgroup of your specialty area, that's something that the Chamber can help you with. There's a trend among chambers around the country where small groups of like-minded professionals are coming together to do a mini version of what we're doing here, and sometimes on a more regular basis, sometimes quarterly. But for example, at my last chamber, we had a long-term care professionals group that met monthly, and they addressed things like regulations, regulatory issues, advocacy issues, things like that. Each group is managed by the participants themselves. They set the agenda, they set the schedule. The chamber just helps promote and facilitate the gathering itself. And we could do it virtually for now if anyone was interested, not in any way to take away from what this group is doing, but simply to offer you an extension of what is happening here with more specific focus on your particular area. So if anyone's interested, you can reach out to me either through the chat here or through Ruthie or Ellen, or you can just email me directly at bgrady@charlescountychamber.org. And I can give you references to some of the folks who were in the group that we did up at my previous chamber in Cecil County, and they can give you an idea of the kinds of things that they do as well. But just an added service from the chamber.
Bonnie, I put your email address in the chat.
Thank you.
I see that Tammy responded, said she'd be very interested in setting up the subgroup, which, I think is an excellent idea because, our conversations and our convenings will be specific around workforce. But there are other issues facing your industry that I know that as Bonnie said, the chamber would be very happy to support.
Thanks, Ellen.
Thank you.
Clarissa?
Yes, mine is real quick. I just wanted to piggyback off of Elizabeth. We too, of course, do the telecommuting and the teleworking. And we have tele-agreements already designed that we started our program back in 2018. So I definitely understand, Elizabeth, when you were talking about the revamping of your policies and your procedures and the reviews and all of that. But one thing that I wanted to mention did change, and that was in regards to our telework, we generally had always had it for exempt employees, and we did find ourselves having to add non-exempt employees to that process. Just like Elizabeth said, to keep those really good quality employees, and just because they weren't exempt, we were able to carve in some type of work virtually for them.
That is wonderful. That is wonderful. I'm sure that industries across the board have been searching, if they haven't already found it, for standards of practice around teleworking. And I mentioned that specifically because I know a telework guru that works at the Tri-County Council, and George Clark, and he is more than happy to speak with individual organizations or groups of organizations who need some guidance and some resources on establishing telework policies. So I just wanted to put that out there as an available resource in our community to help support that work, because we're all being challenged to do things differently, and I think, as Elizabeth said, we'll be doing them differently for quite some time. I don't think it's a short-term thing at all. Okay, any other issues? Or Ruthie, did you have something?
Yeah, I just wanted to ask, since Tammy, we do have you on the line, what is your requirement for CNA, GNAs in terms of numbers? Are you fully staffed? Do you need more individuals with these certifications?
Yes, we actually do. We need to hire several GNAs at this time. And so if there's a potential way for us to get a class, I know we get a lot of phone calls here asking about us doing a CNA, GNA class. We no longer do that. We typically do refer them to CSM. But if there's another contact that we can refer people to, we're happy to do that.
And that's for folks that are interested in becoming GNAs?
Yes.
Yes. Yvette Turner.
Okay. Got it.
Yvette, put your email in the chat, please.
I have it.
Okay. And Kelly Winters just put in the chat that there is a CNA, GNA class starting next week.
Great. I'd love to have maybe a virtual session with the class if they're interested on what we do and that sort of thing.
Tammy, what agency are you from? I'm sorry.
That's okay. Asbury Solomons.
Asbury Solomons. Okay. I put my email in the chat a few minutes ago. Can you send me an email so we can set up a time to discuss?
Absolutely.
Thank you.
Thank you.
And Kelly, why don't you include Yvette in that discussion, and we can talk about the possibility or potential for setting up a contract training.
Okay.
Mm-hmm.
We're in somewhat of a tight spot with CNA, GNA right now because of the restriction on getting actual clinical hours in the nursing homes because of the opening phase of the nursing homes. So we are working on a solution with some local partners. So that may be somewhat restrictive of the number of individuals or classes we can have running at the same time. We will have less available clinical sites. So we can take a look. I will certainly include Yvette when we have the conversation. We have a second CNA GNA class that we are just opening up. So that'll be 32 CNA GNAs that I anticipate will be trained before December, that will be in the workforce looking for jobs. And we still do have a waiting list for our CNA GNA program at the college, and we are working as hard as we can to expand our resources to train those individuals right now.
I have a question again for for Tammy. While Asbury does not train CNA GNAs, might there be a way for the CNA GNAs that complete the classroom training to do clinicals on site?
I can definitely request that and talk with our nursing home administrator and our director of nursing to see if that's a possibility.
Okay.
So I do believe that Asbury Solomons is one of the facilities we have a clinical MOU in place with, and that's not the issue here. The issue here is the
visitation.
Is the what?
Visitation. Right now, students are considered non-essential healthcare personnel, so they're not permitted in the long-term care facilities.
Yeah, that's a state reg.
State reg.
So does going to phase 3 change that at all, Kelly?
It does not.
It does not, okay.
It does not.
Okay. Yeah, so it's a tight spot that they put us in, but we're working on some things. Kelly's a wizard. She will figure this out with all of you. So we're working on some things. Yeah. Including some technologies. That's one thing that we should plan to do with this group. I would love to. You guys saw me get excited there for a minute. We're procuring some great virtual reality and augmented reality technologies that we're introducing to our healthcare programs. That we will have acquired by the time we have our next quarterly meeting. And if there's time, we'd love to, we can share it with you virtually. Kelly, wouldn't that be cool?
Oh, I'd love to see that again. You know I would.
Yeah, maybe we can do that. We're finding all types of ways, as you are, to adapt to this new environment of teaching and learning. And we're finding ways to put technology in the hands of our learners at an earlier stage, because they have to be comfortable with it. We certainly have a generation of digital natives that we work with, but there are multiple generations in the workforce now, and not everyone is a digital native. And so the exposure and the hands-on use of technologies early in learning becomes critically important. And so there's so many technologies out there now that are advanced, and we've been fortunate to get some grant funds that is going to allow us to acquire some of them to support healthcare and manufacturing training programs here that we're developing. So certainly maybe we'll take some time during your next quarterly convening and show off our new toys. You see what your students will be learning in the classroom. Okay, so we have 10 minutes. Is there anything that we haven't talked about that you as an industry would like to talk about before we adjourn this convening? Okay. Ruthie, anything else?
No, nothing else. I want to thank everyone for joining us this morning and continuing this important conversation, and stay tuned.
Yes. Take care, everyone. Have a great week. We'll certainly get the next quarterly meeting date out to you guys soon.
Thank you all.